Hello everyone, my name is Parminder. Today my topic that I'm presenting is on chlamydia. So what is chlamydia? It is a sexually transmitted infection which is common spread to vaginal, anal, rectum, or oral sex. It can be transmitted from a mother to a newborn during a vaginal delivery. In order for chlamydia to be transmitted, ejaculation does not have to occur. And parts of the body where it occurs are vagina, penis, throat, cervix, rectum, etc. That's where it shows the symptoms. How is the test done for chlamydia? Actually, there are two ways. First is the swab of the fluid from the vagina or penis that may be taken. The second is urine sample that may be taken. They both are used to test for the bacteria that causes chlamydia. Here is the difference between a healthy cervix and a cervix that is infected with chlamydia. There is pus and some soreness to it comparing to the regular one, which looks fine. So the cause of infection, as I mentioned earlier, the tests are done to see the bacteria, and the bacteria that causes the chlamydia is called Trachomatis. Chlamydia often is a major cause of eye disease and pneumonia. Infections are often acquired from wildlife. According to the article, Animals Linked to Human Chlamydia Pneumoniae, Dr. Tim says in the article, chlamydia pneumoniae was originally an animal pathogen that crossed the species barrier to humans and had adapted to the point where it couldn't be transmitted between humans. What they think now is that chlamydia pneumonia originated from amphibians such as frogs. Professor Timms also said that it was important to understand the origins of zoonotic infection. Animal infection is also called zoonotic infection, to know the risk that animal infections have to human. And they've also mentioned in the article that when an infection occurs from animal to human at first, and then it mutates in human to human, it changes. The infection rate changes, and it's much more dangerous to humans than in animals. So here is a picture which shows some some similar symptoms that men and women can have. They both can have abnormal discharge. Both can feel pain and burn while urinating. Men can have swelling on their testiculars. Women can face bleeding between their periods. This is symptoms of the chlamydia may not appear for several weeks, which is hard for a person to know whether they are infected or not until a test is done. Men and women can also get infected in their rectum, which includes symptoms of rectal pain, pain during sexual intercourse, rectal discharge, bleeding, pain in lower abdomen. There are ways you can manage your symptoms. Not much, but some. You can keep your genitals clean. Do not douche. Basically, what that means is do not use any sprays or other feminine hygiene product until your doctor tell you to do so. Treatment for chlamydia, it can be treated with antibiotics, which are only prescribed by the doctor. These antibiotics can be one-time dose, or It can be a many days course, multiple times a day. The antibiotics that are used to treat chlamydia are azithromycin or doxycycline. These are the main two antibiotics which are given to treat chlamydia. There are other teachings besides the antibiotics. You have to abstain from sex for 7 days, whether you had a single dose or a 7-day course of medication completion, or until a medical 7-day course of medication completion. And medication should be taken as directed. It should not be shared with a partner or anyone else. Who does it afflict? Who have more chances to get chlamydia? People who already have another sexually transmitted infection, being sexually active before the age of 25. It was actually mentioned in the article. There were more cases of chlamydia in women who were sexually active between the ages of 14 to 25. If you have multiple sex partners, the chances are more. Of course, not using a condom consistently in a proper way causes MSM, that is men having sex with men, that are at more risk of having chlamydia. So if left untreated, chlamydia can lead to serious illnesses. It can make a permanent damage to women's reproductive system. It can make hard for women to get pregnant. PID, which is a pelvic inflammatory disease, it is an infection of the uterus and fallopian tubes that causes pelvic pain and fever. These severe infections might require hospitalization for intravenous antibiotics. PID can damage the fallopian tubes, ovaries, and uterus, including the cervix. As these organs of women play an important part in the pregnancy, so if they get messed up, so the entire reproductive system is damaged. Ectopic pregnancy. Ectopic pregnancy is in which the fertilized egg implants outside of the uterus. The fertilized egg can survive outside the uterus. If it's left to grow, it may damage nearby organs and may cause life-threatening loss of blood. In pregnant women, it is also associated with preterm delivery. It also causes pneumonia or serious eye infection in a newborn, as I mentioned already. For men, infection is near the testicles. Rarely, the chlamydia organism can spread to a man's prostate gland. Prostatitis can cause pain during or after sex, fever and chills, painful urination, and lower back pain. There is a control and you can do to prevent being infected by chlamydia. Of course, using a latex condom. You can talk to your sex partners. You do not have sex until you and your partner have taken antibiotics. You can get regular screenings for STI. You can limit the number of sex partners, or you can talk to your doctor if you're pregnant. Tell whomever you have had sex with in the past 60 days. This is my works cited that I use for my project. Thank you.